Welcome to Sustainable Health Empowerment's Health Education Series. My name is Mark Bannikin. I'm an internal medicine resident at UCLA Allevue, and I have been a volunteer with SHE for nearly 7 years now. I have helped participate and plan the inaugural medical mission trip to Cambodia in 2015. This trip was initially called Cambodians in Globalization, which was a study abroad trip with Cal State Long Beach and also a medical mission trip. Here are our objectives for the day. Number 1, we're going to understand that COPD includes emphysema and chronic bronchitis. Number 2, we're going to identify the widespread incidence of COPD worldwide. 3, we're going to identify risk factors for developing COPD and that it cannot be cured. Number 4, we're going to identify the symptoms of COPD. And finally, we're going to understand how COPD is diagnosed. So let's jump right in. COPD is not just one condition. It is a term used to describe chronic problems with breathing. This includes two main conditions, emphysema and chronic bronchitis, each of which affects the lungs differently. In emphysema, the walls between the air sacs break down, causing them to lose their shape and their elasticity. Look at the second picture. This means that there are fewer and less effective air sacs, so gas exchange is reduced. Often, people with emphysema develop very expanded chests as their lungs struggle to work. In people with chronic bronchitis, the lining of their airways is constantly inflamed and irritated. This causes the lining to thicken. Lots of mucus forms in the airways, making it very hard to breathe. Most people with COPD have both emphysema and chronic obstructive bronchitis. COPD worsens over time, limiting a person's ability to do routine things. Severe COPD can make it hard to even do basic things like walking, cooking, or even taking care of themselves. According to the 2004 World Health Organization, they estimate that 64 million people suffer from COPD, and 3 million have actually died from it. It is mostly diagnosed in middle-aged or older people. It is not contagious, and it cannot be passed on from one person to another. Unfortunately, there is no cure for COPD, but treatments and lifestyle changes can help people feel better and slow the progress of the disease. Most cases of COPD occur from long-term exposure to lung irritants. And these major risk factors are, number 1, smoking, indoor and outdoor air pollution, job exposure to dust and chemicals such as vapors, fumes, and irritants such as asbestos. Remember that the lungs can be damaged by secondhand smoke. This is when someone else is smoking around you. So even if you don't directly smoke, if you're around others that smoke, it can be a risk factor for COPD. They can also be damaged by air pollution, chemical fumes, dust, and unvented fumes from cooking indoors. In older people, COPD can develop from untreated asthma when they were younger. People with COPD have the following signs and symptoms. They can have a chronic cough or a cough that produces a lot of mucus. They could have shortness of breath, especially when they're doing any physical activity. They could have wheezing, which is a whistling or squeaky sound when you breathe. They can also experience some chest tightness. And usually they have a history of smoking or exposure to the lung irritants that we mentioned. Remember that some of these symptoms can be signs of other problems, such as acute bronchitis, which is when you have it for a short time due to something like a flu. The key question is, what are your risk factors? Did you smoke? How long have you had these symptoms? And if you have any concerns, see your healthcare provider. People with COPD may have colds or the flu often. They may also have swelling in the ankles, feet, or legs, bluish lips because of the low oxygen level, and shortness of breath. Symptoms worsen over time. You may adjust your lifestyle to make breathing easier, such as taking an elevator rather than the stairs. If you keep smoking, the damage to your lungs will occur faster. If you see any of the following severe symptoms, immediate care is needed. If you have trouble catching your breath or talking, if your lips or fingernails turn blue or gray, if the person is not mentally alert, or their heartbeat is very fast. Your healthcare provider will diagnose COPD based on your history and symptoms. They may also ask you about your cough, how long it's been going on, and whether you are coughing up any mucus. Your doctor may order other tests as well, including a chest x-ray, blood work, lung function tests such as spirometry. Let's review what we have learned. People with severe COPD often have which of the following symptoms? Shortness of breath, swelling of the belly, bluish lips, bleeding gums, or swelling in the ankles. Remember that more than one answer choice can be correct. Yes, the symptoms of COPD are shortness of breath, bluish lips, and swelling of the ankles. These are all possible symptoms of COPD. Today, we have looked at the types of COPD, risk factors for its development, and symptoms and diagnosis. Next week, we're going to focus on treatment. Thanks so much for tuning in, and be sure to check out our next episode and all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment.